to DadsDivorce Live. I'm Matt Allen, editor of DadsDivorce.com. Our guest today is Elizabeth O'Brien, a writer for financial information website MarketWatch.com. She recently published an article concerning the impact of the Affordable Health Care Act on the recently divorced. Elizabeth, thank you very much for joining me.
My pleasure, Matt. Thanks for having me.
Now, in your article, you mentioned that in the past, recently divorced couples have often had issues finding health care immediately following their divorce. So how does the Affordable Health Care Act change that, and why was it so difficult before?
Well, the Affordable Health Care Act is expected to really change the landscape in the divorce process. So what happened previously, usually immediately following the divorce, if one spouse was on the other's health plan, the non-employed spouse, as we'll call that person, now in reality that person could be self-employed or employed at a business that doesn't have health insurance, but we'll call just for convenience sake this person the non-employed spouse. Usually the non-employed spouse would have the option of getting COBRA coverage under the ex's plan for 36 months. So prior, there was not an access issue to insurance. There was that option of remaining on COBRA, but there was a price issue because COBRA is prohibitively expensive. So people who could afford COBRA would do that for 36 months. People who couldn't had to get their own insurance on the individual market. And the individual market is not a very friendly place for people who have pre-existing conditions and people who might be a little bit older. So sometimes people, in extreme cases, people with pre-existing conditions would maybe be denied coverage, not even divorce. Now, granted, this is more common with older people than younger people, but people who are looking to divorce who are a little bit older, I've heard attorneys say, would actually wait for Medicare age, wait until they're 65 to divorce because they could be assured access to coverage. So that is going to be a big change now with the Affordable Care Act. The non-employed spouse is going to have the option of going on to healthcare.gov, finding a plan that may or may not be cheaper than what they could get before, but certainly the access, they cannot be denied for pre-existing conditions anymore. And likely the plan, if they are eligible for federal subsidies, the plan could also be cheaper. So some attorneys tell me that this actually is going to remove a barrier to divorce for people. It's going to make it easier. It's going to take away one of the fears that people had of being left without coverage.
So what happens in cases where spouses own long-term care insurance together? How does the act change that?
Well, the Affordable Care Act doesn't specifically address long-term care insurance. There was in the initial drafting of the bill, they had a provision addressing long-term care insurance. That ended up getting taken out. So there is no direct effect of the Affordable Care Act on long-term health insurance, although divorcing people who have bought long-term care insurance together have to think of that as a factor. They have to research what will happen with their policy because there are certainly implications. A lot of couples today are issued not separate policies, but a single policy. So if you have a separate policy, parties must notify the insurer so they can get billed separately. And then if people have a shared care rider on their policy, that's a policy that allows one spouse to tap the other's benefits if they need it. Like one will use up the benefits first and then there might not be anything left for the other. That's a scenario where you might need to not just get billed separately, but change the policy or itself drop that rider. So bottom line, if you have a long-term policy together, call the carrier and figure out what the implications are going to be.
Now, your article touches on spousal support. So how does the Affordable Health Care Act impact alimony or maintenance as it's known in some states?
Healthcare costs are a factor in the divorce negotiations. So oftentimes, the non-employed spouse might argue for more money to support for health insurance payments once that person has to go on his or her own and get coverage individually. So healthcare costs are already a factor in divorce negotiations. And alimony, which is these support payments, are tax deductible for the payer. So the person who pays them gets a tax deduction. The person who receives them has to declare them as taxable income. Now, how this factors into Obamacare, as the Affordable Care Act is colloquially known, is that you are eligible for federal subsidies based on your modified adjusted gross income. So basically, individuals who make up to about $46,000, families of two that make up to $62,000, families of three that make up to $78,000, and families of four that make up to $94,000 are eligible for subsidies that will lower the cost of their insurance. Now, how the alimony comes into play here is that by virtue of paying alimony, the paying spouse might become eligible for subsidies, whereas he might not otherwise have been. So maybe the fact that once you deduct that amount out of his income, the alimony out of his income, that might drop him down to subsidy level. Whereas on the other hand, the receiving spouse, by virtue of getting alimony, might get bumped up into a higher income level that will make her eligible maybe for a smaller subsidy or maybe even no subsidy at all. So what divorce attorneys are saying is that this is just going to add another layer to the alimony negotiations. People might try to negotiate for an amount that's going to still preserve their ability to get a subsidy, and it's just going to be an added factor in the alimony discussion. And another wrinkle is that many states are expanding their Medicaid coverage. They're making more people eligible for Medicaid, which is the health insurance program for the poor. And that could also make the divorcing spouses eligible for Medicaid, in which case, the attorneys might say, well, you know what, we don't need to even pay anything toward this ex's health care coverage because that person now gets Medicaid. So we're going to actually lower the alimony because the person is now eligible for Medicaid, so let's reduce benefits. So, yeah, it's definitely going to become just another factor in the alimony discussion.
Now, finally, and obviously, our viewers are primarily single dads. So how will the Affordable Health Care Act impact children of a divorce?
So one provision of the Affordable Care Act has already gone into place that's affecting kids. So those people with grown kids, adult children, can now stay on their parents' plan until they're 26. So that is one part of the Affordable Care Act that's already having an effect on grown kids. Now, as for all other kids, the full implementation of the Act might change the assumptions about who's going to carry the kids on their plan. So what happens now typically is that the kids will stay on the employed spouse's plan. Even if one parent, the non-employed parent, has primary custody, the kids will typically stay on the employed person's plan. Now that coverage is more widely available, it might be more affordable for folks. The assumptions just might be different. Now it might not be a given that the kids will stay on the employed spouse's plan. Now there's going to be more maybe back and forth discussion about who's got the best options and how that's going to all work out. So I think it's probably going to open up the possibilities and lead to a bit more negotiation of who covers the kids.
Well, Elizabeth, thank you very much for joining us and shedding light on the issue of how the Affordable Health Care Act impacts divorce. I appreciate it.
My pleasure, Matt. Thanks for having me.
That was Elizabeth O'Brien, a writer for financial information website MarketWatch.com. I'm Matt Allen, editor of DadsDivorce.com, and that'll do it for this episode of Dad's Divorce Live.